Welcome to This Week in Allergy and Immunology. This week we're covering 10 notable papers spanning advanced biologic strategies in respiratory disease, global food allergy prevention and immunotherapy, and environmental and clinical documentation interventions. Let's dive in. Biologics continue to redefine the management of severe type 2 airway diseases, but choosing the right agent and understanding long-term response remains a clinical challenge. In a systematic review and network meta-analysis, researchers compared 7 biologic agents across 15 randomized trials involving over 3,600 patients with severe chronic rhinosinusitis with nasal polyps. At 20 to 24 weeks, dupilumab and stapokibart led to the greatest reductions in nasal polyp and nasal congestion scores compared to dupemokimab, omalizumab, and benralizumab, with no significant difference observed between dupilumab and stapokibart. By 48 to 56 weeks, dupilumab and tezepelumab showed superior outcomes over dupemokimab, mepolizumab, and benralizumab. For patients with concomitant asthma or aspirin-exacerbated respiratory disease, tezepelumab and dupilumab demonstrated distinct advantages over other biologics. This choice of therapy is particularly relevant for patients with non-steroidal anti-inflammatory drug-exacerbated respiratory disease or NSAID-ERD. A review in the Journal of Allergy and Clinical Immunology in practice outlines the strategic balance between aspirin therapy after desensitization or ATAD and targeted biologics. While post-operative ATAD remains a highly cost-effective disease-modifying intervention, its success depends on complete surgical debulking and strict daily adherence. In contrast, biologics like dupilumab, omalizumab, mepolizumab, tezepelumab, and dupemokimab offer potent, non-surgical alternatives that target specific inflammatory pathways, though their high financial cost remains a major barrier. For highly refractory cases, clinicians may need to consider a stepwise approach or combination therapy. Moving to severe asthma, a real-world cohort study also published in the Journal of Allergy and Clinical Immunology in practice evaluated the effectiveness of tezepelumab in patients who are often excluded from clinical trials, specifically smokers and those with concomitant chronic obstructive pulmonary disease or COPD. Among 186 patients treated for a median of 12 months, lung function significantly improved across all cohorts, including those with a smoking history and those with overlapping COPD asthma control test scores, quality of life, oral corticosteroid reduction, and annualized exacerbation rates improved similarly across the groups, supporting the use of tezepelumab in these complex, real-world populations. However, sustaining clinical remission with biologics over the long term remains a variable process. A study in Allergy International utilized data from the Australian mepolizumab registry to evaluate sustained remission and relapse over 2 to 4 years in patients with severe eosinophilic asthma. Out of 184 patients assessed at 24 months, nearly 30% achieved clinical remission, defined as a stable asthma control questionnaire score, no exacerbations, and 0 oral corticosteroid use. However, only about 20% sustained this remission, while 9% relapsed during treatment. Older age, severe disease, obesity, and depression significantly reduced the odds of achieving remission. Over a 4-year period, 17% of patients relapsed, highlighting that clinical remission can be transient, and patients may transition between disease states even during ongoing mepolizumab therapy. Early life nutrition and timely interventions are critical to shaping immune development and preventing food allergies, yet global implementation practices vary widely. An European Academy of Allergy and Clinical Immunology scoping review. The review confirmed that greater dietary diversity and timely food allergen introduction in infants and toddlers are linked to a reduced risk of food allergy and asthma. Conversely, restrictive feeding practices and Western-style diets high in processed foods, fat, sugar, and meat correlate with an increased risk of allergy. Despite these clear guidelines, actual clinical practice among healthcare professionals varies significantly across the globe. An international survey of over 700 healthcare professionals from 80 countries revealed 2 distinct practice patterns for allergen introduction. For high-risk infants, recommendations for peanut introduction diverge between a median of 6 months of age in early introduction countries and 18 months of age in late introduction countries. Healthcare professionals in North America recommended peanut introduction nearly 7 months earlier than those in Asia, and pediatric allergists globally advocated for earlier introduction by more than 2 months compared to non-allergists, highlighting a substantial geographic and specialty gap in guideline adoption. For patients who do develop severe allergies, such as lipid transfer protein syndrome, which is a major cause of severe food allergy in Mediterranean populations, immunotherapy offers a promising path. A 5-year follow-up study, Asthma and Immunology, evaluated the long-term quality of life in patients with lipid transfer protein syndrome, treated with sublingual immunotherapy using a peach extract. Patients receiving the immunotherapy showed significant and sustained improvements in food allergy-related quality of life up to 5 years after treatment, particularly in emotional impact and allergen avoidance, while untreated controls showed no clinically relevant changes. Furthermore, as we look to refine food allergy management, diagnostic tools like the basophil activation test are being evaluated in clinical and experimental allergy to provide additional diagnostic value beyond standard allergen-specific IgE testing in peanut allergic adults. Finally, addressing indoor environmental exposures and improving clinical documentation are practical, high-yield strategies for managing allergic diseases. In the Journal of Allergy and Clinical Immunology, in practice, a pre-post study of 85 individuals with poorly controlled asthma evaluated the impact of replacing gas stoves with electric stoves. Following the stove replacement, indoor nitrogen dioxide levels decreased significantly from 21 to 6 parts per billion. This environmental change was associated with a dramatic improvement in asthma control scores and a reduction in emergency room visits or hospitalizations from nearly 12% at baseline to less than 4% at follow-up, demonstrating the clinical value of reducing indoor combustion exposures. Turning to clinical documentation, another study in the Journal of Allergy and Clinical Immunology, in practice, analyzed over 47,000 penicillin allergy labels within a large United States healthcare system. Only 23% of these labels were complete across all coded electronic health record domains, and a mere 11% met the criteria for optimal quality documentation. Patients who were older, female, had more comorbidities, or had visited an allergist had higher odds of complete documentation. However, manual review showed that nearly 80% of free text comments contained clinically useful information, suggesting that better utilization of electronic health record tools could significantly improve penicillin allergy delabeling efforts. If you only have time for one paper this week, make it the systematic review and network meta-analysis of biologic agents for severe chronic rhinosinusitis with nasal polyps in the Journal of Allergy and Clinical Immunology. This comprehensive analysis provides clinicians with a much-needed comparative framework, showing that dupilumab, tezepelumab, and stapokibart offer superior clinical benefits over other biologics, helping guide personalized treatment selection for our most challenging patients. Here are the key takeaways from this week in allergy and immunology. First, in severe chronic rhinosinusitis with nasal polyps, dupilumab, tezepelumab, and stapokibart demonstrate superior clinical efficacy compared to other biologics, though direct head-to-head trials are still needed. Second, real-world data support the effectiveness of tezepelumab in patients with severe asthma, regardless of smoking history or comorbid chronic obstructive pulmonary disease. Third, while clinical remission is achievable with long-term mepolizumab therapy, in severe eosinophilic asthma, it is often transient, with nearly 1 in 5 patients relapsing over 4 years. Fourth, significant global disparities persist in early allergen introduction practices, with North American providers and allergists recommending peanut introduction much earlier than their peers in Asia and non-allergy specialties. Fifth, replacing home gas stoves with electric stoves significantly reduces indoor nitrogen dioxide levels and leads to clinically meaningful improvements in asthma control and reductions in emergency healthcare utilization. That's your roundup for this week in Allergy and Immunology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.